wanted to take a minute to talk about why I think it's so important that you have options when considering manual therapy treatment, and why we've decided to include cupping, instrument-assisted massage, as well as percussion massage in our neuro release treatment course. You know, as a new grad PT and early in my PT career, I trying to figure out the best way to help people, right? So you're going to all these different courses, you're traveling all over the country, spending who knows how much money, learning all these different techniques, and every course you go to, their method is the best, right? This is the only way to treat people. And then you go to this course and this is the only way to do things. And then you get on social media and there's 10,000 different opinions. Should you even do manual therapy? What is exercise? And it becomes very confusing. And especially as a new therapist without a lot of experience, how do you put it all together? And that was something that I always found very difficult. And I was lucky and fortunate enough to have really good mentors in Dr. Frank Gargano, the president of Integrative Dry Needling, Dr. Dave Griswold, one of our instructors with IDN, as well as a professor at Youngstown State, and our other professors at Youngstown State, which were amazing. And I had this framework, and very lucky to learn from them and hear their thoughts on how this all entangled together. And the more I got into the understanding of manual therapy and looking at the neurologic aspects of what we're doing with dry needling and manual therapy, as well as the chemical and inflammatory responses to some of these different manual therapies through blood flow, I began to see a lot of overlap. And now all of a sudden, whether you're talking exercise, you're talking cognitive changes, you're talking different manual therapies, you can start to see how those different treatment techniques interact when we talk about the sensory experience, when we talk about the brain's response to those techniques, we talk about blood flow changes those techniques. Now we have an interaction of multiple different techniques and how they all come together to treat. And then it was kind of an epiphany of, well, in that case, does it matter which technique I use? If I can alter that pain experience through changed sensory input, through changed circulation, through changed perception of the brain, if I can alter that experience, does it matter which technique I go with? Probably not. So in that case, let's use the one that's the most comfortable for the patient. And that means I need to have multiple treatment techniques, right? Dry needling, one of my favorite techniques, obviously very impactful. There's times where it's not appropriate, right? So in that scenario, I'm still going to use this understanding of the neurologic system. I'm going to look at inflammatory and circulatory markers, but instead of using dry needling, I'm going to switch to something else, right? I'm going to switch to cupping or instrument-assisted massage. And from there, I'm just applying the technique that my patient finds most beneficial. Why it's so important to have options is that if I only know how to do instrument-assisted massage, per se, now every time I treat somebody, that's the technique I'm going to go to because that's what I have available to me. That's what I know. There's times where it's great. There's times where it's not. So by having options, I can switch between each of those and provide the right technique for the right patient under the right situation. And then ultimately, I'm going to create a better experience for my patient. And if I have a better experience, ultimately, I hope they're going to have better outcomes. And so that's why we've decided to include multiple techniques in this NRT course so that you can seamlessly switch between those techniques, apply the right technique for your patient, get better outcomes, get that person back to doing what they love doing. And that's ultimately why we all join the rehab professions. So we hope you give an opportunity to learn with us and integrate this NRT course into your system. I think you'll find that because we're focused on the why of why manual therapy works and looking at the sensory and neurologic aspects of pain and manual therapy, then it'll fit into your treatment paradigm. It'll integrate into that very well for you, and you won't find that it's one of those courses where it's my way or the highway type of an approach. It's going to fit into your understanding of pain and the way you normally look at things. I just hope that it gives you another lens of a way to look at the system and how everything is interacting. And that's really what we want to present in our neuro release treatment course, is a way to look at the system, to look at the neurologic system, to look at the inflammatory markers that are involved, and treat your patients giving all the available data that you have, using the right technique at the right time. And that's ultimately what we want.